Welcome back. For this chapter, I'm going to introduce you to Anita Klemetska, who is the executive coach for the Senior's Choice. She comes to us with a world of experience in caregiving and in assisting caregivers to be better at what they do. Please welcome Anita.
Thank you, Pete, for that wonderful introduction. One of the most important aspects of caring for someone, and seniors in particular, is helping them avoid injury and illness. In this section, I want to discuss a few simple and effective methods for reducing your client's exposure to common causes of illness. Throughout this course, you'll be introduced to a number of medical terms. The first is pathogen. Pathogens are the microorganisms or germs that cause disease. There are many ways for pathogens to be transmitted to human beings. One is person-to-person transfer by touching, sneezing, coughing, or the exchange of body fluids such as blood, semen, feces, or urine, and others. Another way is through contaminated food, water, or objects. Transmission of most infectious or contagious diseases can be prevented by regularly taking a few simple precautions. Washing your hands is an important and easy way to greatly reduce the spread of infection. All caregivers should wash their hands frequently. When should you wash your hands? When you arrive at a client's home, before and after touching a client, before or after any meals or any work that you do in the kitchen, after using the restroom, after touching any item used by or for the client, before you leave a client's home, every time you remove your latex or vinyl gloves, and after touching a surface that may be contaminated with any body fluid. Wearing gloves is another important way to prevent infection. You must wear gloves whenever there's a chance that you might come into contact with body fluid, open wounds, or mucous membranes. Those are the membranes that line the body cavity, such as the mouth or nose. You should always wear gloves for the following tasks. Anytime you might touch blood. Whenever performing or assisting with mouth care or care of any mucous membrane. When performing or assisting with care of the perineal area. Now that's the area between the anus and genitals. When handling body fluids such as vomitus, urine, feces, or saliva. When performing personal care on a client whose skin is broken by abrasions, cuts, rash, acne, pimples, or boils. When assisting with a client's personal care when you have open sores or cuts on your hands. And when shaving a client. Spills in the home, especially involving blood, body fluids, or glass, can also pose a serious risk of infection. You should clean spills using proper equipment and procedures. When blood or body fluids are spilled, put on gloves before starting to clean up the spill. When glass has been broken, don't pick up any pieces, no matter how large, with your hands. Use a dustpan or broom or other tools. If blood or body fluids are spilled on a hard surface such as a linoleum floor or countertop, you need to clean it immediately using a solution of 1 part of household bleach to 10 parts of water. You can mix the solution in a bucket and, with gloves on, wipe up the spill with rags or paper towels dipped in the solution. Or you can mix the solution in a plastic spray bottle and spray the spill before wiping. Be careful not to spill bleach or bleach solution on clothes, carpets, or bedding, as it can discolor and damage fabrics. If blood or body fluids are spilled on fabrics such as carpets, bedding, or clothes, do not use bleach to clean the spill. Use a commercial disinfectant that doesn't contain bleach. Use gloves to load soil bedding or clothes into the washing machine and add color-safe bleach to the washer with the laundry detergent. Waste containing broken glass, blood, or body fluids should be properly bagged. Put the waste in 1 trash bag and close it properly. Then put the bag inside a second clean trash bag and close it. If you are diligent about following these procedures, you'll be effective in the prevention of many common illnesses. This completes Chapter 3 on infection control. Now we'll go back to Steve for Chapter 4 and a discussion of safety and body mechanics.